Hey everyone, welcome back to the channel. I am here today with Natasha Timberlake. Natasha is a seasoned professional with over 13 years of experience in revenue cycle management. Her diverse career spans several crucial areas of healthcare administration, including front office operations, medical assisting, billing, coding, managing accounts receivable. Natasha holds a bachelor's degree from WGU in healthcare management, and she has a pretty strong academic background going back for your master's soon, it sounds like. And currently she works as a clinical provider auditor at Elevance Health, where she continues to contribute to her extensive knowledge and skills to enhance healthcare management practices. Natasha's journey reflects her dedication to the healthcare sector and her commitment to excellence in every aspect of her work. Thank you so much, Natasha, for coming onto the channel today.
Thank you so much for having me. I really appreciate it. I'm so honored.
Yeah, I'm excited to have you here. You've really been like shining lately, and I'm just so happy to have you on here. So you've got over 13 years of experience now in healthcare, in revenue cycle, like not just billing, coding, like whole rev cycle, the whole thing.
Yes.
So starting from medical assisting, billing, coding, accounts receivable. Can you share what kind of initially drew you into that kind of healthcare management field? And particularly then how did you get into like medical coding and auditing?
Funny story, my mom was actually a medical coder. She was in the medical field for a very long time. She was in the Navy. And then when she retired, she went into the medical system medical coding. So I actually knew about medical coding back in junior high and high school. So I remember her looking through the books, the regular monitor, used to go back into the office. My sister's a medical coder. So I actually didn't want to become a medical coder originally because I knew all the extensivity, but I knew being in the medical field was a great field to be into. So I started off in the front office, and then I went into pediatric medical assisting, and then I moved into billing and accounts receivable. But I realized going through it that coding was actually part of the puzzle pieces for it. And I really like solving the problems and putting the pieces together, because coding is essential with the billing and accounts receivable, which is the back end, and the medical assisting in the front office. So all the positions are integral for it. And I'm really, really glad that I did it from the beginning instead of from the end. So that's how I got into coding. And then I'm in auditing now for the payer side as well. But I feel like if I started over just on one end and then do the others, then I wouldn't have an understanding of it.
Right. So it's funny, like you were reluctant at first to get like right into medical coding, but it kind of made you more well-rounded that you didn't start out. That's awesome. So your mom was also a medical coder?
Yes, my mom was a medical coder for many years.
Oh,
yes.
wow.
And she actually did the HEMA side. So she did physicians and outpatients. So she was in a HEMA before it kind of AAPC got big as well.
Yeah.
It was CCSP. So she, before she passed, she actually retired as a medical coach. She did it for a very long time.
Oh, wow.
So I was kind of hesitant to do it because I knew it was such hard work to do. But I really like how, you're able to, look. And actually, that was before Encoder. And that was back when you had to sometimes, I think before they did CMS 15, I know sometimes when they did it, paper claims, sometimes I'd write it. I remember the IC9.
Yes.
I remember her going through those codes, but it was just very interesting.
I remember hearing back before we made the transition to I-10, I didn't know anything about, it wasn't PCS back then. I don't remember what they called it. But on the inpatient side, about how you had to like calculate the DRGs and stuff. And I'm like, wow, that sounds way above and beyond what I'm ready for right now. Like, I'm going to stay in my little provider coding world right now. But yeah, I can appreciate that. So reflecting on, you've had multiple roles now as you're currently a clinical provider auditor.
Yes.
Too at Elevance. So you work for the payer end.
I work with the payer side.
But you're auditing the providers.
Yes.
Yeah. So that's cool. Yes. So what have been some of the most challenging aspects of working in healthcare management and medical coding, and how have you kind of navigated that?
I am a fixer. I like to fix things. So I guess the downside is that I see some of the documentation. I'm like, provider definitely needs a lot of provider education. And then I see stuff on, the medical assisting side in the front office. But my big concern is that the left hand doesn't talk to the right hand. And then one blames the other, or blames the other, because a lot of the departments, even small practices and big practices, they don't talk to each other.
Yes.
And so I can't really fix anything like the claim denied, but then not able to talk to coding or talk to billing. And then it may all start up just in the front office, but then not able to talk to each other. That's timely filing, lost revenue.
Right.
And then that means that the provider doesn't get paid. You're not able to keep the lights on, and then the payer doesn't pay what they need to pay. But you also want to make sure you don't get overpaid either, because to deal with all that. So my thing is I want a whole 100% clean claim If the payer gets paid, like the payer sends out the correct payment, provider gets the correct payment, there's no more extra patient responsibility. They know exactly what they're paying, and then everything is golden. But unfortunately, it doesn't work like that. So it's more of like an understanding and appreciation of each role so that you're able to have more understanding of it. So maybe you can come in and help that role, or if you're AR, you can send better questions to coding in regards to those claims.
Yeah, I think it takes having the correct leadership in place to really bridge those gaps in some of the segmentation we have in the revenue cycle, where we have people that are in their silos and they don't speak to each other. It really takes, it's not difficult to do if you have the right communication and the right segues in there that someone can almost liaison in between and say, yes, it's okay, you can go out to the front desk and do some training there maybe, and maybe they're doing some things that, doing registration wrong, for example.
Exactly.
Has a huge impact down the line for the entire cycle of the claim then.
Starts up front.
Right? So, we have to really work on, getting it out of that cycle where it's like, oh, well, they're not doing this right. They're not registering the patient right. Well, if I don't do this, they're not going to bill, Right. So, I think
and patient education, because patients are afraid to ask questions.
Right.
Or they don't want to give the pertinent information you're needing up front.
Mm-hmm.
Or when they call, they're not angry about their bill, but they're not giving time to people to research what's going on. So then we may have to call the insurance company. The patient may have to do that. So it's kind of making sure that we don't have all this angriness.
Or even, I've noticed it's kind of a passive way of educating the patient, where you'll walk into a facility, and it's one of the ones that looks like a provider's office, and they have that sheet of paper attached to there that goes, this is a facility, and you're going to get a facility charge for coming into this provider office. Well, a patient who's checking in because they're sick or they're not paying any attention. They don't know what the heck a facility fee is. So it's a step maybe in the right direction, but not all there.
No, we need more. Now that we're back into a lot of in-person, we need more communication in person as well.
Yeah, absolutely. Absolutely. And you have a lot of background, not just in doing the front office and the billing and the coding and the auditing now. Yeah. You have a lot of certifications too as well.
Yeah.
You have, do they call it the chonk? I feel like some people do call it the chonk, right?
Yeah. I spell it out, CHONC, but yes, but I have many coding certifications.
That one, the CRC, CPPM, COC, you have the CRCR, which is through HFMA, which is really growing in popularity.
Yes.
And their training for that is dry as hell. I'm so sorry, Natasha.
You're fine.
I tried it once and I'm like, oh, the CRCR is growing. I'm like, I want to see what this is. Maybe I can do some videos talking about the CRCR and how to prepare for the exam. And I could not get through the material. Oh my God, I could not.
It was hard for me. It was very hard for me too.
It was like, it wasn't even like video presentations or anything. Or they're like here, it was literally, it was just.
It is. It's hard.
It's tough material to get through. So hats off to anyone who has gone through the CRCR, because it is dry material to get through.
But they have a lot of pertinent. I have to give them that though. They have a lot of pertinent information that I didn't personally learn.
Yeah,
the different revenue cycles. So I'll give them that.
Yeah,
they did really well with that.
So how have all these different certifications kind of impacted your career? And what advice do you have for people that want to get a lot of certifications as well? And especially if it's through like multiple organizations.
Well, when I originally, like I said, I didn't originally want to become a coder. But as I went through the processes, especially in AR, I saw codes all the time, because you're seeing the approvals, you're seeing the denial, seeing, towards like a zero pay and bundling, NCCI edits, you're seeing the modifier issues, your primary code and your secondary code, but they just built the secondary code. So I think the coding really, really helped me in regards to my AR. I came to be one of those go-to people. Plus, I was able to call the insurance company. So I actually became CPC and COC before coding, because now I knew exactly.
Wait. So you weren't even in.
No.
So you were in billing?
Accounts receivable,
and you got your CPC,
and COC.
Oh.
Yes. Well, because I looked at UB04s all day, every day for 5 years. So that had a lot to do with the outpatient, because there's different methodologies for it. You have the rev codes and such as well. So that really helped, which I love UB04s. I'm still relearning to see them as 1500. But
I'm exactly the opposite.
But in order to get into coding, you have to be certified. Yeah. And so, but I think this really helped me because I'm able to call the insurance company. I know what I'm looking for. Insurance company may say, hey, it denied. And they denied. I need to know why it denied. What's going on? If not, I have more pushback. Or I can pull information, okay, denied for this, and that. Then I can send it to the HIM department, and give them the exact information needed so they can review it, see if it was coded correctly, it needed to be appealed instead of just it denied and that's it, because then it's lost in translation.
Yeah.
Or I can find payer trends like, okay, well, this one, a lot of these are denying what's going on. Maybe it's upper level, maybe the tax ID number API is not working correctly. So that really helped. And also that also helps getting towards the A because that is still technically experience as well.
Yeah, and that's a great tip too. Anything where you're working with codes can help you get that apprenticeship status removed. It doesn't have to be that your job title is medical coder. As long as you can prove that you're working with ICD or CPT or HCPCS on a regular basis, not necessarily coding things from scratch, but you're working with those code books, working with the code set.
Because I had my apprentice off before I started coding.
Yeah, because the CPC and the COC are the only ones that have the.
Yeah,
those are the two you have.
And productivity. Working AR, you have to deal with productivity because you have to keep your numbers up.
Yep.
That's a big thing, whether you're in the office or working from home. And coding, you have productivity. So this also helped me getting my coding roles because I already knew about productivity standards and quality and quantity, because you're going to have to make sure that you're keeping up your quality with your productivity, but also your quantity because you're getting audited. You need to make sure you're getting those percentages like for auditing, like 95, 98%. That'll really help you into your role. And then actually when it makes you want to code better, because you know what happens after it doesn't get coded correctly, or if it's denied or pushing insurance company, you have to call them. So now you want as clean claim as possible, because you know what happens whenever it's not processed correctly.
Yeah. And then you have patients calling. And
exactly.
I mean, I know people don't like getting medical bills. I don't like getting medical bills. But it's just when the process works as efficiently as it should, and you don't get the medical bill, and the patient doesn't get that surprise in the mail, it's like everything works okay and it's smooth. It's just when we have problems, that's when you hear about
exactly. And it helps you read the EOBs and the denials and such as well, even your own EOBs, like, hey, this actually was not processed correctly. So then you can call them, make sure, verify it. But it helps solve them. I'm a problem solver, so I like trying to fix things. And each certification is different. Like mine's my personal, like I got each one depending on what role I was doing and what I wanted to learn, because I want to continue my education. But, you know, like mine's different than yours, and then next person. So don't have that deter you. Like you may just have a CPC and that's amazing, or you may want everything else and that's wonderful as well.
So with having your oncology certification, did you specialize in oncology at some point? Do you work right now a lot in oncology or not so much?
Not so much. I worked part-time before for oncology hematology. Actually, that was my first coding when I worked at Yale for oncology hematology. I love it. That's my niche. Like, and that's actually where I got certified about a year later. Like, I will always want to code oncology hematology. It's very hard and difficult with infusions and injections, but once you get it, it's like, boom, light bulb is golden. I also want to learn different specialties as well. Not necessarily coding, but like learning cardiology. Very difficult. We have, dermatology, but that's a little harder for me because of depending, synods and drainage, the biopsies and such as well. But the specialty ones I got was because of the role I was in, or I want to learn. So I don't necessarily have to take the certification exam, but getting like, the AAPC or other entities, their information, study guides, and knowledge, that's just to knowledge base and help you out in regards, just in case you ever come across that.
So let me ask you this, because you work so much with UBO4s.
I used to, not
used to.
Yes.
Have you considered getting like an AHIMA certification?
Yes. Actually, I am.
CCS?
I'm interested in CCS, and the reason being I actually did inpatient denials. So I understand the PCS coding. I like how they build the codes, but it's very difficult. And so I like a challenge. And then actually I'm going back to school for my master's, for a master's in HIM, so I can sit for the RIA. Because I want to be all well-rounded.
Right.
But it is difficult in the beginning to have multiple certifications with multiple entities. So that's the only downside.
And that's a great segue, because I want to talk to you about the formal education. So you're going back for your master's, and where are you going for your master's?
Southern New Hampshire.
Southern New Hampshire. Awesome. So how do you kind of view the role of formal education in preparing professionals for healthcare management and healthcare billing and coding and stuff? Like, do you think, who would you recommend get like their bachelor's degree, their master's degree?
People in leadership who want to be in leadership, who may not have as much management experience, but they have like training, and they have team leads and such, and they want to learn and grow not only in like management but director and eventually the C-suites, because they need the higher education. That's usually a requirement. And plus, not only that, though, sometimes it does help in a boost in pay because you have that additional. So it really depends on what you want to do. But a lot of times having this certification also helps as well. But my thing is, I don't want to be pigeonholed. I want more have available opportunities, just depending on what I want to be able to do. And I'm a glutton for punishment. I just want to continue learning and growing and just keep on with my education. I said, no, I'm not going to do my master's. What am I doing now? Wasn't going to do my bachelor's. Finish that. But it's hard work, but it's having that diploma on your wall and having even certifications, even after CPC, hanging up on your wall, and very proud of your accomplishment, even the small things. It's just like, I did this. I'm like, oh, this is just amazing. And, the people that you can show that anybody can do anything at any age, because I didn't get my bachelor's completed until September 2022. It took me a long time to complete it, family, work, and all that stuff. But it's just take one class at a time.
Well, and we have such great programs out there now that it's not like it was 10, 20 years ago where you had to take night classes for forever and a day in addition to having the family if that's what you wanted to do. Now everything's online. It's so flexible. You can take a semester off if you need to. You take extra classes if you need. Like, everything is just so more accommodating now to that flexibility that we have in our lifestyle. So it makes it so much easier to go back when you're past typical college age.
I definitely was
to do that. Yeah, so that's great. And I think one of the interesting things about getting additional formal education is, like you said, it's great if you're getting into leadership roles. You want to be more well-rounded. You want to understand more. But we need to also understand that the fact of having a bachelor's degree alone doesn't always mean the bump in pay. You have to do the associated work with the roles that necessitate 100% a bachelor's degree.
Because my additional certifications didn't bump my pay, even before as a coder. Sometimes your pay will bump up, like you said, the additional work. That's a big thing. And showing what you, not only your worth, but show what you could do for the company, how you can help them, how you can bring to the table. Because sometimes they may not have the extra revenue to give you the extra pay. Or sometimes you're capped at the role. So, and not only that, it shouldn't always be based on pay. Because I've had jobs that hadn't paid very well, but I loved my jobs. And I've had jobs that paid pretty well, and I didn't like my jobs. So it really all depends on find out what jobs that you want to do in your role. Pay is great, but it depends on where you live at too. That's a big thing, and everything's virtual. But California pays a lot more than other states. But they're, but at the same time, their cost of living, so they need that.
I've heard now though that there's some kind of situations going on where, because of tax laws or something going on with California, like more organizations aren't allowing you to apply for the jobs in California unless you actually live in California.
That is true.
Yeah, so we're starting to see some pullback on that. And I don't know exactly what all the laws and regulations are, but I know I've heard that.
And experience helps. So the longer you have experience and the years of experience will help. Just because if you're new and you haven't any experience, you may not get. But also customer service really helps. But starting in those positions that I started, what some people call entry levels, like I'm quoting it, kind of one of my pet peeves, is that it's still hard, it's still integral, and you'll still learn a lot. Like it is a great position to get into, because you may not want to be a coder. You may want to be being a nurse, or you may not want to do medical assisting. You may want to do different positions you may never realize, or different specialties you wouldn't have gotten in before. So definitely keep your options open in that as well.
And there's so much going on now too, I think, with AI, that we'll probably start seeing some more opportunities opening up as well, like we've seen in the past with electronic medical record, where people have started getting Epic certified, and they work in all these different aspects of Epic, and they get, Resolute, and all these different certifications they can get. So we might start seeing that with some of our AI software as well.
I said that's all, like the IT portion of it in healthcare, because there's so much to do with healthcare on all different ends, and hospitals and physicians' office. Like there's the opportunities are endless, and there's enough seat at the table so everybody can come in and help out.
So you mentioned that you kind of have a passion for understanding how all of the positions come together within the revenue cycle, and that they're all very integral. Could you talk a little bit more about this? And do you have any stories that maybe you could share about collaborating with different roles and how that was impactful or provided some operational efficiencies?
Sure. So like I said, I started in 2010 as a front office. So I actually finished graduating with my associates in medical insurance billing and coding. But I didn't start, when they started that was like, they were just talking about ICD-10 CM. Granted, 5 years later that happened. But it really helped to be able to, I realized that the claim, it's more to claim it's a patient. So what you're doing in all aspects, you're helping out the patient. That's my goal. Because from front office, checking the patient in, you're great customer service, great rapport, you're like the face of the company. You never know, you're walking in, they have a bad day. You could be the person to help them out. Medical assisting, helps you look at clinical charts. Now when I'm looking at SOAP notes, I'm like, medical assistant at BP, looking at medications, helping a lot of asking the questions. Now we have a lot of social determinants of health. They can ask a lot of those questions now the physician may not think about as well. We're able to work with that. And then also you see the patients, sometimes you see them all the time. Like I work in pediatrics, so I got to see the babies grow from newborn all the way up, and that was really interesting. And then billing. Now I'm like, okay, so what happens after the claim? The provider sees the patient. Now they're, before I did coding, so this is all before you code, so the billing after it's been coded and you're sending out the assurances. Well, now you got to learn assurances. Medicare has certain codes. And then if there, it has ABN need to be signed, provider documentation, and then accounts receivable. Now you have more understanding of what happens whenever you're seeing a claim or more pushback or even fighting for the payer or fighting for the provider, like for all the revenue. But at the end of the day, my goal is to make sure that the patient pays what they're due, like they're supposed to, but anything extra. Because what if they have something other going on and they may not be able to pay, but at the same time, patients are due the responsibility, could be imposed deductibles, but what we're doing makes a difference. Even if you're not in the office, I feel like if I can just help one person or one patient, even if I'm not there, make their day, then that's all that matters.
Have you been involved much with local chapters? I can't remember if you've worked as an officer in the past or...
I'm an officer this year, as an educational officer. And I'm also a speaker as well. And I really like that, being able to help with the education, because we have new coders, seasoned coders. But now I'm really glad, and I know it's kind of sad with post-COVID, I'm really glad that a lot of them we can have virtual, because there's a lot of people who were able to get speak what we didn't realize before.
Right.
It's so much different specialties and so much different aspects, because we're all looking at different areas that I never would have thought of looking at it.
Right. The pool of skills that we have that we can tap into now, and understanding and knowledge is just amazing. Because before, it used to be if you were working in cardiology and you didn't know what you were doing, you either had to find someone nearby that knew cardiology, you had to maybe fly to a cardiology seminar. But now you can keep an eye out for all those local chapters and be like, oh, where's Terry Fletcher speaking at? I'm going to go.
Oh my goodness. I love her. She's amazing. And then even if you don't know about speaking, if you have a specialty that you're really good and you love, go for it. Just start speaking about it. Like, share the knowledge. Like, that's, and I've learned from people like you and others who are like, eventually we're going to retire, like later on, retire. I was like, but we want to share the knowledge to give it to the new coders. So that's my goal, is like and everything's changing. I have AI. So people 5-10 years from now coming in, it's going to be completely different than we are, but it's just, healthcare's changing. That's the constant thing, is to change.
Slowly.
Slowly. But don't be afraid of change. Like, it's going to happen whether we want it or not, but as long as we can acclimate it to it, and just overall just be positive. But I'm a positive person, I guess.
So then, kind of speaking to some of the advancements that we're having in healthcare, what kind of trends and innovations are you seeing that you're kind of excited about? And then how are we as professionals kind of supposed to prepare for some of what's coming up?
I'm excited about new technologies. I know there's a lot of different clinical trials going on. There's different, and then like cardiology have different surgeries, oncology have a lot of different clinical trials for different medications. Yeah. So that's really interesting. I know things are quite expensive now, but I like how we're able to save people's lives. Compared to back when, a long time ago, where they just started getting antibiotics. And actually that was kind of by accident, I believe. Don't quote me on that. But it's one of those things of just, I like how the technology is different. I like how we're able to do things. And I know AI, I'm hesitant, but I'm not, because I know it's going to be there. But as long as it's done good and the right purposes, then that's great. But knowing that we are still going to have a job, our role may be different. And so that way we're able to still help or have our input in it. It's just, I'm excited to see what's going to happen.
I feel like with some of the AI things, it's starting to almost feel reminiscent of when we had to go on electronic medical records, and there's that initial panic. And I'm like, you know what? Now that I'm kind of thinking about it and how it kind of is the same as when we brought on EMRs, when we need to figure it out, we'll kind of figure it out. Yeah. I don't know that there's anything we can do to prepare for the systems that we haven't even implemented and developed yet.
Yeah. But it's not really going with the flow. Like, speak up if you find an issue, help correct it. But at the same time, just what you can do to help at the same time, but be prepared, like not be prepared, but be okay with it. Like, it's going to be here, but how can we make it better for everybody to be able to use, so that way it's more efficient? And like you said, especially the EHR, like it's amazing now, but you have like electronic, but a lot of people were very, very afraid in all different aspects of it. And I'm like, it's here, so might as well just make the best of it.
And I'm sure back then they were saying probably the same things that they're saying now. Oh, when we get onto electronic health records, all your jobs are going to be gone. Yeah. And we're not going to. So I'm just like, you know what? Now we've been through this so many times. I'm tired of hearing it.
I know.
So finally, for those that are looking to start or advance their career in healthcare management and medical coding, what is your key piece of advice that you would offer based off of your journey, your experiences?
Just go for it. Like, don't be afraid. And when you're looking at different positions, make sure it's kind of an idea of what you want to do. Like, don't go just for the pay, and don't go just for the job itself. Know that maybe a job that is just a stepping stone, and that's okay. Or, I want to go here and kind of pivot and kind of go around, but it's going to take time. And that's the big thing, is that my role took a long time, but I chose that. Somebody else's role may take longer or shorter. It really depends, but don't give up. And don't And I know it's really hard, but don't compare to others, because a lot of time in social media, you're just seeing the end result. You're not seeing the long, hard hours, the work, the ups and downs, the cries. And just know, we've all been where you've been at. We've all been new coders. We've all been exactly about the frustration. And then be positive, especially on social media. Put a good name out there for yourself, because a lot of people I know and I follow, they're like, healthcare is a small field. 1 to 5 people are going to know who you are. And you may be sitting next to your new employer or your new, or the next person that, you may be seeing later in life. Like, it's just, you want to make sure that you have positive career field. And, there's enough spot here. Like, there's plenty of room, and don't pigeonhole yourself. Like, make sure that make yourself invaluable, because you're a valuable person. You're very integral to what we're doing, and everybody's important. And then at the same time, it's all about patient care. Like, that's a big thing that we're trying to help patients, because we are also looking at this coming in from us. How would we want to be treated when we go in the office? The whole aspect, and at the back end, like, if we're getting all these bills, like, how do we want to be treated?
Absolutely. I love that. Well, good luck on your master's degree program. Is there anything else exciting coming up for you, Natasha?
That's a big one. I start in May. Okay. I'm really nervous, but I'm just gonna go for it, because I like the health information portion of it. I have my business degree, and I just want to continue with that, and then be able to sit with the RIA. But it's just like, honestly, I don't know what I want to do. Like, there's so much out there to do that I'm just like, just to keep going with
it. You can keep your options open. Absolutely.
Yes, definitely.
So where can my viewers connect with you online if they want to know more about Natasha?
Everywhere. So I'm really big on LinkedIn, and I'm the only Natasha Timberlake. I have to thank my husband for my famous last name. I'm also, on social media like AAPC and Facebook and stuff. But yeah, and in my email too. Reach out anywhere. And if you have any questions, I don't know, I'll reach out to my, connections and stuff, and we'll be able to help you out, because we're all here to help each other out.
All right. Well, great. Thank you so much, Natasha, for coming on today.
Thank you so much. I appreciate it. And thank you guys as well.